Your child has a fever. You wait for the appointment. You finally see the doctor, and after all that, you hear just 3 words. It's probably viral. For many parents, that can feel frustrating. You may wonder, what does that even mean? How do doctors decide it's viral? And why are antibiotics not always given? In this video, I'll explain what doctors really mean when they say it's probably viral and what you should actually watch for at home. Welcome to Clinic Explained, practical medical education made simple. When a doctor says an illness is probably viral, it means the symptoms are most likely being caused by a virus. Viruses are one of the most common reasons children get sick. They can cause fever, cough, runny nose, sore throat, vomiting, diarrhea, tiredness, and poor appetite. And this is important. When a doctor says viral, it does not mean nothing is wrong. It means your child most likely has a real infection, but one that usually does not need antibiotics. In many cases, the body improves on its own with time, fluids, rest, and symptoms relief. Many parents feel worried when they hear it's viral because it can sound vague. Sometimes it feels like the doctor is dismissing the illness, even when your child clearly looks unwell. But usually, what the doctor is really saying is this: right now, based on the symptoms, the exam, and how your child looks, this illness does not appear to need antibiotics. That is very different from saying your child is fine or that nothing matters. Doctors do not decide viral from just one symptom. We look at the whole picture. First, we look at how the child looks overall. Are they alert? Are they responding? Are they drinking? Are they breathing comfortably? Then we look at the pattern of symptoms. For example, fever with a runny nose and cough often fits a viral pattern. Vomiting or diarrhea with no severe dehydration may also fit a viral illness. We also look at the examination. Are the lungs clear? Is there an ear infection? Is the throat concerning? Is there a rash? Is the abdomen soft? We also look at the age of the child. A very young infant is different from a healthy older child. And we look at timing. How many days has the fever been there? Are symptoms improving or getting worse? So when a doctor says it's probably viral, it usually means the overall picture looks more consistent with a viral illness than a bacterial one, at least at that point in time. This is one of the most important things parents should understand. Antibiotics treat bacterial infection. They do not treat viral infections. So if the child most likely has a viral illness, giving antibiotics will usually not help. And unnecessary antibiotics can cause problems. They can lead to diarrhea, rash, side effects, and sometimes make future bacteria harder to treat because of antibiotic resistance. Sometimes the safest prescription is not an antibiotic. Sometimes the best plan is careful monitoring, fluids, fever comfort, and knowing what warning signs to watch for. If your doctor says it's probably viral, what should you actually do at home? First, focus on fluids. Make sure your child is drinking enough. Second, focus on comfort. If fever is making them miserable, you can use fever medicine if appropriate and advised for their age. Third, watch how they look. Are they becoming more active after rest or medicine? Or are they becoming more sleepy, weak, or difficult to wake? Fourth, watch their breathing. Fast breathing, chest pulling in, or obvious breathing difficulty should never be ignored. And finally, watch the trend. Many viral illnesses improve gradually. If your child is getting worse instead of better, that matters. Even if an illness is probably viral, there are times when you should go back and seek urgent medical care. Please seek medical attention if your child has difficulty breathing, poor feeding or sign of dehydration, very little urine or fewer wet diapers, persistent vomiting, a seizure, a concerning rash, unusual sleepiness or difficulty waking, or symptoms that are clearly worsening instead of improving. And very importantly, any baby under 3 months with fever should be assessed urgently. So yes, many illnesses are viral, but viral does not mean ignore it. It means monitor the right things. So let's summarize. When doctor says it's probably viral, they do not mean nothing is wrong. They mean the illness most likely does not need antibiotics right now. Doctors look at the whole child, not just the fever, not just one symptom. And as a parent, what matters most is hydration, breathing, energy level, symptom pattern, and warning sign. If the child worsen, is very young, or shows red flags, seek medical care again. If you found this helpful, subscribe to Clinic Explain for practical medical education made simple. And in the next video, I'll explain something many parents worry about. When is the child's cough just a cough, and when it is actually dangerous?